Welcome everyone to another Life and Breath Foundation educational webinar. My name is Sarcoidosis. I'm a board member here at Life and Breath. We're very happy that you joined us here tonight. Tonight's topic, questions to ask your doctor after your initial diagnosis for sarcoidosis. Before I introduce tonight's speaker, a few words about Life and Breath Foundation. Our primary goals to offer the sarcoidosis community effective tools to track their journey, decipher medical issues, and maximize their quality of life. Provide a nurturing environment for those affected by sarcoidosis so they can share their experiences. Build more awareness within the medical community to help combat this chronic disease. Just a note, the questions for tonight's session have already been pre-submitted online, but if you do have additional questions, just feel free to submit them, and we'll do our best to get them answered online for you as well. Our speaker tonight is Dr. Gina Patel. Dr. Patel will again discuss the important questions to ask your doctor when you get the diagnosis for sarcoidosis. A bit about Dr. Patel. Dr. Patel got her undergraduate degree from Virginia Tech in finance and biology. There she participated in the Health Brigade to Honduras, where she helped serve over 1,100 patients over 4 days. She went on to receive her medical degree from St. George's University in Grenada, and she joined the internal medicine residency program at Greater Baltimore Medical Center, where she is currently a second-year resident. Given her professional interests in pulmonary and critical care medicine, she is the recipient of the first Life and Breath Scholar Award, which aims to further help patients with sarcoidosis. In her time away from work, she enjoys traveling to countries with rich historical and cultural backgrounds and spending time with her husband and one-year-old daughter who keep her quite busy. Dr. Patel, welcome. Enjoy. The stage is yours.
Thank you, Saul. I'm just going to share my screen. Okay. So thank you so much, Saul, and thank you everyone who's joining us on this Thursday night. I just want to say that I'm so honored to be a Life and Breath Scholar. I'm a firm believer in being your own advocate when it comes to healthcare. Nobody knows you or your goals and desires better than you. And I know that Life and Breath really does try and help, everybody a part of it advocate for themselves and really take control of their sarcoidosis. And in my opinion, the best way to become your own advocate and to really be in control of your diagnosis and treatment is by asking the right questions, which is why tonight I'll be giving this talk on what questions I think a patient newly diagnosed with sarcoidosis should be asking their provider. And so this first one may be a bit obvious, but I still wanted to start with what is sarcoidosis. You may have gone to see a doctor for a cough that wouldn't go away, maybe some fatigue, and they may have ordered a chest x-ray or maybe a CT scan. And the next thing you know, the diagnosis of sarcoidosis is being considered. So what is it? Most doctors will describe it as an immune system dysfunction, where the system designed to attack threats from outside has now started to attack the inside world, leading to an inflammatory state in your body, which will ultimately lead to the symptoms you may experience. The most common symptoms are cough, shortness of breath, or chest pain, and it's often accompanied by other general complaints such as fatigue, fever, weight loss, and this feeling of just not quite feeling well. And so the next question to ask is, how was I diagnosed with sarcoidosis? Or along the same vein, if you're not yet formally diagnosed, how is the diagnosis of sarcoidosis made? Depending on the symptoms you presented with and the parts of your body suspected to be involved, your doctor can go down one of multiple avenues in making the diagnosis. This often starts with an initial x-ray, possibly followed by more advanced imaging, such as with a CT scan, an MRI, or even a PET scan. And given that sarcoidosis is known as the great mimicker, meaning that many other diseases do present very similarly, your provider is going to work to rule out those other diseases. They can use both imaging as well as other blood tests or lab work to rule out other diseases and to sort of help make sarcoidosis the front-running diagnosis. And then making the diagnosis does ultimately lead to requiring a biopsy, where a sample of tissue is analyzed under the microscope for signs of sarcoidosis. So always remember to ask your physician how a biopsy will be obtained. It can be obtained through bronchoscopy, which is where a lung doctor can insert a small camera and needle through a tube into your lungs in order to biopsy portions of your lung that are located closer to the middle of your body. Or a different physician called an interventional radiologist can use CT guidance in order to obtain that biopsy from lung tissue that's closer to the outer chest wall, such as in this picture over here. And as you're going through the diagnosis process, really understanding what parts of your body are affected by sarcoidosis is incredibly important. As the picture shows, virtually any part of the body can be affected, including the lungs, the skin where it may cause a variety of rashes or bumps, the eyes where it may cause discomfort or vision changes, the heart where it may cause you to experience palpitations, a slower heart rate than normal, and it can even affect the liver or the brain. Though the lungs are most frequently affected, with the most common symptoms being related to the lungs and breathing, knowing what other sites are affected also allows you to know what other organs not only need monitoring, but what other symptoms you should be looking out for. And given that any organs can be affected by sarcoidosis, and kind of jumping ahead a step, treatment for sarcoidosis can also affect many different organs, and so it's important to know whether you'll need to visit with other specialists. This may include visiting with a skin doctor for cutaneous sarcoid or other lesions associated with sarcoidosis on the skin, an eye doctor for not only ocular sarcoid, but every patient diagnosed with sarcoidosis does need to visit with an eye doctor annually. A heart specialist for cardiac sarcoid, or a brain specialist for neurosarcoid, or even a rheumatologist for those patients with sarcoidosis that are affecting inflammatory arthritis of their joints. And those are just a few amongst the many specialists that are out there. And so if you are someone who does need a team of specialists to help manage your sarcoidosis, don't forget to ask how your doctors are going to be communicating amongst themselves. With electronic medical records, or EMR, this is made much easier, but not every practice has EMR or has systems that are compatible amongst the different offices. And so knowing how treatment plans are going to be coordinated amongst all of your specialists and your primary care provider is very important to ensure that you're receiving the best care available and that all of your treatments truly are compatible. And so now that the diagnosis has been made, and if needed, your team of specialists is chosen, asking your care team how they're going to determine if you need treatment or not will clue you into the symptoms that you should be looking out for on a day-to-day basis and give you an idea of what monitoring may look like in the long term. In order to assess disease activity and progression, your doctor may recommend serial monitoring with imaging. They may recommend yearly pulmonary function testing, which is a way for them to see how your lungs are behaving. And then more often than not, you will need regular lab work. And so all of this information, plus most importantly, your symptoms, will help your doctor decide if you have active sarcoidosis, if you have sarcoidosis in remission, or you're someone with chronic sarcoidosis. And that's the information that's going to help them determine what treatment, if any, you may need. Not every sarcoidosis patient needs treatment. Some may need it briefly, and rarely, some may need it for life. And so knowing what your care team is looking for as indications that you may need treatment is what's going to help keep you one step ahead of this disease. And if your doctor does decide you need treatment, asking what treatments are available, and then subsequently, what are the side effects of these medications will help you set realistic expectations regarding your treatment course and allow for you to work with your doctor in picking a treatment plan that really does work with your personal lifestyle. Well, there are a few drugs that are the mainstay of treatment, primarily steroids. You and your doctor should come to a joint decision about how you would like your treatment to go. And then asking your doctor what they're expecting to see before they either stop a medication or change medications helps you really keep the big picture in mind as you navigate these details of living with sarcoidosis. And treatment adjustments are needed throughout the disease course. And so knowing what to look out for, and more importantly, what to keep your doctor informed of, will help you form a meaningful partnership with your provider team so that you're all working towards the common goal of keeping you well enough to do all the things that you would like to accomplish. And so this next question, am I more prone to infections because of my diagnosis, has always been an important one to ask, but now in the age of COVID-19, it's become even more important. The answer can really vary depending on if you have sarcoidosis in remission or if you have active sarcoidosis that's currently being treated. With sarcoidosis in general, your immune system isn't quite working right. And when a patient is being treated for active sarcoidosis, the medications that are used work by suppressing the immune system. And so knowing if you're more prone to infections is a must, especially those on the immune suppressing medications to treat sarcoidosis. They really need to ensure that you're having a further discussion with your provider on ways to avoid infection, what precautions you need to take, what exposures or symptoms warrant further investigations. And so these discussions are really necessary in order to minimize illness and avoid further complications from your diagnosis. And then more often than not, sarcoidosis is not the only diagnosis that a patient is going to have. And so asking your provider, how might all of the other diseases that you have been diagnosed with affect your sarcoidosis is not only helpful for you, but it really does open up an opportunity for you and your provider to sit down, discuss your past medical history in detail, and discuss how your sarcoidosis pathway may be affected by all of your other diagnoses. Existing heart disease or chronic lung disease will be affected by sarcoidosis. And so taking time to discuss this can at least help minimize the impact of sarcoidosis will have on the pre-existing conditions. And if it doesn't, at the minimum, it keeps you kind of in tune with what symptoms may crop up later. This question is also very, very important to ask anytime new treatments are started, so as to minimize any interactions between the different medications that you may ultimately be on. So a patient with diabetes, for example, now started on steroids for the treatment of sarcoidosis, may need to keep a closer eye on their sugars, and they may need to have a discussion with their diabetes specialist about adjusting their diabetic regimen, as steroids are known to cause higher sugar. And so both you and your provider being aware of how your past medical history and how your past medications may affect your newly diagnosed sarcoidosis will help minimize complications in the long run. And last, but certainly not the least, asking your provider, how will my day-to-day life be affected, is one of the most important questions you can ask. This opens up a discussion for things like, are there lifestyle changes you need to make, such as quitting smoking or increasing exercise? Or maybe you're an avid gym fan. How will the diagnosis affect your ability to work out? Or maybe you work in a factory with exposures to certain chemicals. How might that affect your disease course or your ability to work? And so really bringing to this discussion a good background about who you are, what you do, what you love, helps your provider not only get to connect with you better, but really tailor your treatment plan to you as the unique individual that you are. And ultimately, as providers, our main goal is to help you meet all of your goals. And the only way that we can do that is if we really, truly do have a chance to get to know you. And so I just wanted to kind of end with this slide, which is all the questions that I think that you should be asking, so that those who are interested can take a quick screenshot or a picture of these questions to bring with their provider. And with that, I'd love to open up to some of the questions that we did receive.
Okay, Dr. Patel, we do have a few questions here for you. Let me start with the first one. Are there any other types of doctors I should see regarding my sarcoidosis diagnosis?
So I did answer this just a little bit in my presentation, but I did want to recap on it because I think this is such an important question. The answer is yes. Sarcoidosis and treatment for sarcoidosis can affect so many different organs. And so having the right team of specialists helping your primary care doctor manage your sarcoidosis can really ensure that each organ affected is getting the best care possible. And even if you only have lung symptoms or lung sarcoidosis that you know of, all patients with sarcoidosis at the minimum really should consider seeing an eye doctor annually. And then when you do meet with this eye doctor, do kind of kindly remind them that you do have sarcoidosis so that they're aware that they need to do the appropriate screening.
Okay, thank you. Are there any other procedures I should be getting? If so, how often?
So that's a great question, but for this one, it kind of depends on what someone defines as a procedure. Biopsies is what I define as a procedure, and those are not typically needed after the initial diagnosis unless there are some questions about new organ involvement or if a new disease or diagnosis is suspected. But on a routine basis, there shouldn't be a need for regular biopsies.
Yeah. How often should I get a CT scan or a lung function test?
So those are both great questions, and I think they've got a very provider dependent answer. For the CT scans, typically in active disease, CT scans are really only done on an as needed basis. With the initial diagnosis, a CT scan will often be done. And after that, your provider may order one if new symptoms appear or if there's a change in symptoms. There aren't really good guidelines on whether regular screening is needed or not. However, many providers will continue to screen with an annual CT scan for a certain period of time. But again, this is really provider dependent. And so I really do have to defer to, individual physicians here. For the lung function tests, which are like spirometry or the 6-minute walk, those are done at regular intervals for someone who is diagnosed with sarcoidosis. It's a little controversial in patients with active sarcoidosis. Some providers see value in doing them about every 3 to 4 months. Others really do like to treat to just symptoms. And so it kind of really is up to each provider, but both ways are okay, and getting a few extra lung function testing isn't really harmful to you. And then as far as somebody who's in remission, lung function testing is typically done annually.
Okay, thank you. Next question. What are some of my options for treating sarcoidosis, and what are their risks?
Okay, so this is quite the question, and not one that I would be able to just do justice to at all, and definitely not in the short amount of time I have. Honestly, this might take 2 or 3 hours even to answer. There is a great webinar that does begin to answer the question on the Life and Breath website. But ultimately, this really does just need to be an ongoing discussion between you and your provider about what the different risks and the benefits are to all of the different treatments that are available out there. I can say, though, that oftentimes the first medication that we do use is prednisone. And while it does come with a known of host side effects, it also is quite good at doing its job in reducing the inflammation that does come with active sarcoidosis.
Thank you. Is there anything I can do to improve my current symptoms that doesn't involve medication?
Yes, of course. Maintaining a healthy lifestyle and reducing extra stress on the body really does give you and your body more time to work on healing from sarcoidosis. This means doing things like quitting smoking, minimizing alcohol intake to the recommended amounts, eating a well-balanced diet, getting in your exercise at least 5 times a week, and then taking time for self-care to really help reduce any mental stress. These lifestyle changes may not completely resolve your symptoms, but every little bit does help. And it really can actually help, I think, even in reducing some of the side effects that do come with things like prednisone.
Thank you. Are there any symptoms I should really look out for?
This will really depend on what part of your body is affected by sarcoidosis. So for someone with lung involvement, worsening shortness of breath or cough may be indicators of worsening disease. Someone with cardiac involvement may have a different set of symptoms, such as palpitations or slower heart rate. But given that every patient is different with different body part involvement, I think the best answer is to really look for changes in your baseline. You know what your baseline is, and so anytime you see sort of a change from that, whether you think things are getting worse or they're different now, reach to your doctor so that they can decide if further workup is needed.
Okay, thank you. Where is the best place to find resources?
Not because I'm biased in any way, but I think that the Life and Breath website has a wonderful set of resources for patient education, from their webinar series to the frequently asked questions section. All of the information is really presented in a very easily digestible but incredibly informative way. 2 other websites I will recommend are stopsarcoidosis.org. I believe that is run by the Foundation for Sarcoidosis Research, and then ChestNet, which is run by the CHEST organization. They also have a good amount of information about sarcoidosis as well. And then, of course, your providers are great resources, and they can really provide information that is tailored to you.
Okay. How often should I, as a patient, make an appointment with my physician?
So, how often you follow up with any given doctor depends on their specialty and then on their disease activity. And so for someone with active lung sarcoidosis, they may see their lung doctor every few months, if not more frequently. Similarly, someone with active liver sarcoidosis may be seeing their liver doctor very frequently. But then for a patient in remission, they may be able to go a whole year without seeing their, specialists. And then I also want to kind of point out that seeing your primary care physician regularly is also incredibly important and should be done also at least once per year, but more frequently as needed as well.
Okay, great. Are there any new updates on liver sarcoidosis, including treatment beside prednisone?
So this is a great question. As far as I know, there hasn't really been any new updates on liver sarcoidosis, and prednisone does continue to remain the initial drug of choice. Depending on your response to prednisone or if there are other concurrent liver diseases present, your doctor may choose to add in additional medications such as azathioprine, also known as Imuran. They may add in methotrexate or hydroxychloroquine amongst the many others available. But this is an individualized decision, and it'll depend on a specific patient's risk factors as well as their personal response to prednisone.
Great, thank you. How is sarcoidosis diagnosed? Is it only through biopsy?
So the diagnosis of sarcoidosis can be made in multiple ways, and Dr. Carr actually gave a great webinar on it in the past that's also up on the Life and Breath website. But the short answer is diagnosis involves seeing classical imaging findings of sarcoidosis on an X-ray or more advanced imaging, such as the CT scan, the MRI, or the PET scan, ruling out other diagnoses through imaging and lab work. And then almost always a biopsy is needed in order to see what we call the hallmark of sarcoidosis, the non-caseating granulomas. And given that lung involvement is most common with sarcoidosis, often the biopsies do need to come from at least the lung, though depending on what other organs are involved, your doctor may want biopsies from other parts of your body as well.
Okay, thank you. If a PET scan lights up in one organ, but not others, is it still possible to have sarcoidosis in one of the other organs?
That's a great question. So a PET scan, like any other advanced imaging, really does give us a snapshot of what your body is doing at the time of the scan. The PET scan works by identifying areas of the body that have active inflammation, and so it's a great tool to pick up active sarcoidosis. It doesn't pick up areas of the body that may become affected by sarcoidosis later. So unfortunately, the answer is yes. Even if your PET scan today only lit up in one organ, it is still possible, though not necessary that other organs may be affected by sarcoidosis later on in the future.
Thank you. How long can you be on steroids safely? And how long after beginning steroids should you request an alternative treatment?
So this really is the million-dollar question here. So I know a lot of patients have fears about steroids, and as providers, we really are aware that there are side effects that patients may experience while on steroids. But for sarcoidosis, we do start with a dose of 20 milligrams, which isn't terribly high. There are people that remain on much higher doses for much longer. And your provider really will work with you to try and keep you on the lowest dose possible while still controlling your treatment. While still controlling your symptoms. Treatment for sarcoidosis really does need to be for at least a 3-month period to evaluate what benefits a medication may have. But really the expectation should be as a patient that you will be on treatment for at least 6 months. Ultimately, however, the decision is kind of going to be a risk-benefit discussion between you and your doctor. And of course, while you are on steroids, there are things you can do to minimize the side effects, such as ensuring you're eating a healthy diet, getting enough exercise, making sure that you're getting all your vitamins in. And so, yeah, I wish I had a great answer for how long you can be on the steroids safely for. There are patients that are on them for life. So it really kind of comes down to what the risks versus the benefits are of extending steroid treatment.
Yeah, well, Dr. Patel, I think that was our last question. Unless you have something else to add, we can finish up. And like to thank you very much for a wonderful presentation and answering the questions that we had sent in online. And again, for everyone who participated and attended tonight, thank you very much. We do provide educational webinars on a monthly basis, so please check our website for upcoming talks at lifeandbreath.org. Again, Thank you very much, Dr. Patel.
Thank you.
And everyone have a good night and stay safe.